Welcome back to Balanced Health. We're talking about cosmetic dentistry with our special guest, Dr. Shefdore. To kick off this segment, Joe's going to debunk another myth, and this time it's about toothpaste.
Well, show you the myth, doctor, is that whitening toothpaste actually whitens teeth. And I think if we debunk the myth, and we're going to look for your comment, rebuttal, or agreement on this, whitening toothpaste can only remove surface stains. It cannot change the permanent color of your teeth.
Absolutely.
Do you agree with that?
Absolutely. And, you know, if you do find something really abrasive and say, oh, I'm going to get the stains off the teeth, honest to gosh, I've had people use Comet on their teeth to try to get stains off their teeth. It'll take the enamel off. You don't want something abrasive. Before, you know, in the last segment, we had something about closest to toothpaste, very low abrasive. You want Tom's of Maine, very low abrasive. So then that way you're not wearing the enamel off. And when you want whitening, we have such a good method today. But we'll talk about that.
You know, it amazes me, Shirley and Doctor, how companies can make claims like whiter in toothpaste, Cheerios saying they're going to help your heart. In the nutrition industry, heaven forbid if you say that your nutrient, your God-made nutrient, is going to do anything, if you don't have that backed up by 15 claims. We had our product pulled by the FDA and held for 2 months as they tested. We have 57 nutrients in our product.
Wow.
And they said this thing basically can't be for real. And they line itemed all 57 nutrients and tested them. Fortunately, we passed with flying colors, but I couldn't imagine them putting General Mills or Kraft through that same thing. So that's kind of a side note of what we deal with our government. But that's it's unfortunate because I've known those toothpaste whitening things to be an absolute waste of
how
time.
many of them are out there, and how much money is being wasted on that because they really don't work.
They really don't work.
Let's talk about some things that do work. What are some of the different whitening methods?
Well, you know, you can, over the counter, you have strips and you have trays that you could go, you know, you have the sensitivity problems with those. Yeah. If you go professionally, you know, now you're running the $500, $600, $700, $800 to whiten your teeth. But can it be worth it? Well, today's whitening, if you look at Ron before and Ron after, we're calling this the wow whitening. And it's very low sensitivity. We actually have a liquid that we put on the patient's tooth before he whitens his teeth to cut down on the sensitivity. But it's that laser whitening or whitening, 1 hour whitening in the office. We do 2 or 3 of those, and then trays in between for the more mature patient. And it works fantastic, as you can see.
So how long would this teeth whitening process take in your office?
You know, it takes a series of a couple of months. But it really gives results and they really stay.
So how many times do you have to come back then?
Depending on the patient, usually 2 or 3 1 hour whitenings, and then for 3 to 4 weeks wearing some trays. Now, we have 3-minute whitening solutions today. 3 minute, that's just awesome.
Yeah.
Because you don't get the sensitivity, you don't have all the mess for hours to do.
I think I sat there when I had my lower teeth whitened for about an hour or something like that. Yeah.
You do the hour, and then we send you home with the 3-minute whitenings. And it's just very easy to maintain the whiteness today.
Let me ask you this, for especially all the baby boomers we have watching, in the 50s and 60s, a lot of tetracycline was given and stained teeth.
Yeah.
Yes.
And I've been told, maybe you've got can debunk this myth if in fact it is one, that there is no whitening system that can help those people whose teeth are stained because of tetracycline. Is that correct?
You know, I'm living proof. I have veneers. And
they look very good.
Beautiful smile.
And I have.
You put them in yourself. That had to be kind of.
It's pretty tough to do.
It must be tough
You gotta have a good mirror.
But I had that streak, and I tried every whitening imaginable, whiten them for a month at a time. I couldn't get the black streak out. So there's some limited success, and it depends patient to patient. I did get some tetracycline stains out with this new whitening method that we have on several patients, but it's not always predictable. So we're not at that level yet. We can do it with certainty.
Okay, so how much, before we move on to what you would do if a person just can whiten their teeth, how much does the whitening system cost?
You know, if you want a 1 hour whitening system, you're going to probably get charged $500 to $800. That would be a good range. If you want a wow whitening like we put on the screen, you're going to spend $2,000, $2,500. Really? Well, you got to keep in mind it's 3 or 4 of those 1 hour sessions.
And how long would those last? How long would that last?
You know, the patients that I've done 2.5 years ago, the color's exactly the same.
Wow.
So we don't know because it's a newer method, but it's much more predictable, but it's cheaper than veneers.
And so let's talk about veneers. There are people who, it's not just a yellow teeth or dark teeth, it's chips or it's, you know, really bad crooked teeth or whatever. So we go to the veneers. Let's talk about that.
Well, veneers are fantastic. If you look at Laura before and after, if you look at Camellia before and after, you could see some unbelievable results. Laura Kriz. Veneers are wonderful for chipped and colored teeth, but there is a cost involved. Now, there are newer veneers. They have newer porcelains that are about half the cost. I'm very excited about it. Yeah, they're called glam veneers. We've been doing them now for probably 2 years.
Why didn't we know about that, Joe?
That's the story of my life.
I know, me too.
Buy high, sell low.
Yeah. And the exciting thing is that they're cemented on the enamel of the teeth. I don't even really have to drill on them.
You don't have to grind them down?
No.
Oh my goodness, that would be
so the sensitivity is better and the bond is much stronger, so then they don't fall off. A lot of problems that we have with the veneers is that we had to drill into the tooth into the dentin, and that gluing to the dentin isn't as strong as gluing it to the enamel.
Okay.
So could you back up on that for 1 second, because several people that I have spoken to when I've talked about it have either known someone or even themselves had their teeth ground down to almost like tiny little points. If they have a dentist telling them that that's the process they use, should they probably get another opinion in this day and age?
What I would do is search, you could search the internet and see if he is a member of the American Academy of Cosmetic Dentistry, see how much experience the dentist has had in cosmetic dentistry. So, you know, any dentist can do cosmetic dentistry, but if they're not really properly trained, you know, there could be some better.
Because there's some real issues with grinding your teeth down to those little points. I remember one friend of mine told me his fell off, and it was ground down so low that just by virtue of it falling off, he had a nerve exposed.
Yeah.
And of course, it happened on a Friday evening. Things always happen like that on a Friday evening. That's a given. And of course, the doctor was gone for the weekend, so he was on narcotics for a few days till he got back and can fix that thing. How does that nerve? You're really grinding it so far down that you're almost exposing the nerve?
You know, sometimes when you grind a tooth down, you don't even have to grind it down that much. Sometimes nerves will die. They don't like to be worked on. They don't like to be irritated like that. And each person is a little bit different. There's patients I work on that don't want me to use anesthetic. There's other people that I use anesthetic on, and then they're sensitive for 3 months. Same method, same doctor, it's just a different person.
I tend to be very sensitive, have very sensitive teeth.
Yeah, you don't want the teeth ground on. So if you can use one of the newer veneers where it minimizes the grinding, I think that's a better way to go, and the bond is much stronger.
What are we talking about with cost on the veneers?
You know, if you go to a good lab, and this is really crucial, the lab is what's going to make you look good, not the dentist. The dentist is preparing it, but it's really the lab tech. The lab that I use, you know, Da Vinci Veneers out in California, there's a couple labs in New York I use, and they work with television celebrities. So you'll get a fantastic, so 1,000 would be a very low end. More typically 1,500
per tooth. Okay.
That would be a low end. 1,500 to 2,000 per tooth. In the Midwest is typical. If you go on the East and West Coast, it's going to be more than that.
Wow, that's very expensive.
How about some of these other things? You know, you hear about, or you're sitting in a dentist chair and you see these seemingly quick fixes for very crooked teeth, like Invisalign and some of these things. And yet my kids have all gone a traditional braces route, although they make them in all different colors now.
Yeah,
that part's pretty cool.
That's fun, yeah.
What do these things really work to straighten out your teeth that are temporary measures?
You know, good question. You still want children in braces because you can actually move their facial bones and make them better looking adults. Once you're an adult, 16,
That's what I missed out on.
Yeah, 16, 17, 18 years old, you really can't move the facial bones. So that's where Invisalign or these clear trays to move teeth come into line. When I took the class, I was the first dentist that went through the class 8 years ago. And I didn't believe it. So, of course, you get your friends and family because they're free, right?
Yeah,
it's like, here, I got this new thing. I don't think it's going to work. And it worked on every one of them.
Wow.
It works
Wow,
perfect. It is great.
That's awesome.
It's very conservative because you don't have to drill the teeth and get veneers. I include whitening at no cost in those trays. That's a very good way to go.
You know, we only have less than a minute. Is there anything here you wanted to mention, or do you want to give your website? Because we're going to be going to other things. I want to thank you for coming on our show.
Oh, thank you very much.
It's been very interesting.
Thank you.
But give your website for sure.
Crowns and Bridge. You don't want to have metal in them anymore. You know, the black lines around there, you don't have to put up with that.
Awesome.
We have new materials where there's absolutely no metal involved, no dark lines. Crowns will look great forever. The website is yourcelebritysmile.com for the people in Chicago. Okay. But you're welcome to fly from Las Vegas or San Francisco.
Right.
We have plenty to do.
But anyway, it's been a pleasure. And, you know, and as we were saying, it's not just, you know, vanity.
No.
It's very, very important. So I would encourage you, you know, if you have the money and you can do it, it's a great investment.
Even if you don't have the money, you'll get more money if you get a better smile.
That's right. Better job.